Welcome back. It is Stroke Awareness Month, and we're focusing on women's health challenges with expert insight. Joining us is Dr. Constance Katsafanis, a neurologist at Marcus Neuroscience Institute with Baptist Health. Doctor, thank you so much for being with us. I'm going to dive right in because I want to take advantage of your expertise and all of our time. All right, so what challenges do women face when it comes to actually getting health care?
So one of the biggest problems that women face is time. It's time, right? It's time away. Like I was saying earlier, this interview is scheduled between, school drop off and me speaking at a symposium. And whereas everyone is busy and everyone has a lot to do, I don't think anybody would argue in saying that, women carry a pretty high mental load, especially those of us who are in households with families, who have small children, who have a lot of people who we perceive as depending on us for our time, for our emotional labor, for our support. It's really hard for women to find time to step away. And it's really easy to say, I'm fine. That will be fine. This will all be fine. Let's just keep going. And the other thing is, and the sad thing is about women's health and what makes challenges for women is that a lot of women don't feel listened to in the medical setting. And a lot of people feel like they have to repeat themselves, or they're embarrassed, or they don't have a relationship of trust with their medical provider. And that is so important. But if you ask 100 men and 100 women, you'll see that a lot more of the women feel like they're not listened to in healthcare. And that's a huge challenge. Trust is a huge part of healthcare.
Yeah, I know. I feel like you're kind of speaking to me. I have two young children at home. I'm sure there's a lot of moms out there watching saying, I can relate to what you're saying here. Talk about some health issues that perhaps affect us as women more than men.
So we are more likely to have strokes. Obviously, there are problems that are going to occur more often in women because we have organs that men don't, uterine cancer, that sort of thing. But also autoimmune diseases preferentially affect women. Things like multiple sclerosis are way more common in women. Pregnancy brings about a certain number of risks as well. Your risk of stroke is higher when you're pregnant. It's not common to have a stroke when you're pregnant, but your risk of stroke is higher when you're pregnant. There are a lot of things that our physiology, especially the way our hormones fluctuate, and the things that our bodies go through when we have children, that, predispose us to problems, to health problems. And it's so important to keep up with your health. It's so important, and especially young women. And I myself was guilty of, I don't need to see a doctor. I'm, X years old. I'm fine. So.
Sure, no, absolutely. I agree 100%. You kind of mentioned stroke and that women have a higher risk for stroke. It is Stroke Awareness Month. Talk a little bit about AFib and what that means and how it plays a role when it comes to a woman's risk for stroke.
So atrial fibrillation, or AFib, is an abnormal heart rhythm. And the way that AFib causes strokes is that when the heart can't squeeze effectively and pump that blood up effectively, it sits around and it forms clots. And then when those clots get squeezed up, the clots get stuck in the arteries of the brain. And when a clot gets stuck in an artery in the brain can't get blood, and the brain tissue, just like a flower bed that can't get water, it wilts, and then eventually it dies. So that's what a stroke is when a blood clot gets stuck. Women do have a higher risk of AFib. There are a lot of theories as to why, and there are a lot of probably reasons as to why, but an abnormal heart rhythm can predispose you to stroke, and it is an independent risk factor for sure. Again, going back to women thinking everything's fine, palpitations can be dismissed as anxiety, just not feeling right, feeling short of breath with activity as well. Of course, you were doing activity, there's nothing wrong with your heart. But AFib, whereas it's more common in older individuals, can affect younger individuals too. So women who are feeling like these palpitations, they're like, oh, maybe it's anxiety. That's a big favorite. It's probably just anxiety, but no, it could actually be an abnormal heart rhythm, and it's something that should get checked out because it is absolutely a risk factor for stroke.
Yeah, really good information. A reminder for us to be our own advocate and to take care of ourselves as some of those, the people in the household who do bear a lot of the responsibility. Thank you so much for your insight, Doctor. Really appreciate it. If you'd like to know more, you can head to our website, WPBF.com.